The cycle threshold is a surrogate marker of the amount of virus that a patient has in his body. Hi, I'm Dr. Valerie Tay. I'm an ENT surgeon. Today I'm going to discuss the Straits Times article that said patients are no longer infectious 11 days after falling sick. And I will also explain the 3 different tests that can be done for COVID patients. The short version of that article is that detecting COVID-19 viral material using the PCR test is not equals to having viable virus in the patient. It's like identifying a person from the blood at a crime scene, but it doesn't mean that that person is still alive. Now that we've got that out of the way, I'm going to discuss the 3 different types of tests that can be done for patients who are suspected of COVID-19. The first one we'll discuss is the real-time polymerase chain reaction. The principle behind RTPCR is amplification. This means that DNA is multiplied to a threshold value which would then be considered positive by the machine. We're going to use bunnies to illustrate the power of 2. If you start with 2 bunnies and each of them will reproduce 2 bunnies, in the 3rd generation you will have 8 bunnies. Now if they continue reproducing, in the 30th generation you will have 1 billion, 73 million, and many hundreds of thousands of bunnies. It's important to understand the concept of the cycle threshold. The CT value is the number of doubling cycles required to reach a value which is considered positive. The cycle threshold is a surrogate marker of the amount of virus that a patient has in his body. The fewer doubling cycles it takes to reach the threshold value, the more viral material there was to begin with in the sample. Conversely, a higher CT value means that there was less viral material in the sample. So remember, PCR detects DNA material, but it is not a marker of viability of the virus. The second test we'll talk about is viral culture. An organism has to be alive to be cultured. The issue with viral culture is that it's expensive. It takes time, anywhere between 1 to 10 days. Now the 3rd test we'll talk about is the viral serology. Serology is a blood test that detects antibodies in the blood. There are a number of test kits which are commercially available. You can even purchase them online. But when NCID did a study to compare the serology test kits to the PCR testing, they found that the serology test kits were not very accurate. So at this point in time, I would not recommend that you use any sort of test kits to check your serology to determine if you are COVID positive or COVID negative. Which brings us back to the Straits Times article and the position statement by the ID physicians. So what the ID physicians did was to correlate the CT threshold with whether or not the virus could be cultured. And I read from the statement, when the CT value was 30 or higher, no viable virus has been found. And they also found in this local study, which is a multi-center cohort study of more than 70 COVID-19 patients, that the virus could not be cultured after day 11 of the illness. I hope you found that useful. If you did, please like and share, and follow me for more updates. Thank you.